Every year, U.S. visitors make 1.2 million trips across the Mexican border to this tiny border town so they can receive affordable health care.
Welcome to Los Algodones, guys.
A lot of people live here in this town because of the dental tours. A lot of families eat about the dental terms that we have here.
More than 300 clinics are in a place around 7 square miles.
In Hawaii, it would have been easy up to $45,000.
Do you have dental insurance in the U.S.?
It is, but it's worthless.
What began with one dentist in one clinic more than 50 years ago grew into a series of interconnected industries, all either serving or surviving off of medical tourism.
Siempre tratamos de que el turista que viene aquí, darle un cálido recibimiento, que se sienta cómodo, que se sienta seguro, pues para que esto mismo no desaparezca.
But what does it mean when even middle-class residents of one of the world's wealthiest nations are forced to cross the border to receive health care?
Try to live my life with my mouth closed and not smile.
And how impactful is the influx on Mexicans who live here?
What would happen if all of the dentists and doctors went away? What would happen to the townspeople and the locals?
He will die. He will die.
Hold it. Right and hold it. Right and hold it. Open. Right and hold it. Open. Okay. I'm gonna show you with a mirror. Okay, open a little bit.
I'm in postal code 21970 in Los Algodones, Mexico, aka Molar City. It's a place about 10 miles from Yuma, Arizona, and its economy is synonymous with dental tourism. As soon as you enter the town, you have your choice of optometrists, pharmacists, cosmetic practitioners, and dentists, the town's primary financial driver. Many U.S. visitors here cross the border on foot. Traveling from the U.S. is easy if you can afford to get here, but the option is entirely out of reach for the poorest U.S. residents.
Okay, open a little bit. Okay, all the blue spots are there.
It's where Charles Keene, a 60-year-old California resident, is inspecting the extensive dental work Dr. Paula Duque has done on him after years of pain and failing oral health.
I had, in January, effectively 28 teeth removed. I had 10 implants installed along with whatever grafting the doctor felt was appropriate.
How much did you pay here for all that work?
In 19,000 plus or minus.
How much would it cost you in San Jose?
55,000 plus or minus.
This desert town is an oasis of medical care for U.S. residents priced out at home. A home with the world's most expensive healthcare system.
Do you think you'll ever do any of your dental care in the U.S. ever again?
No. I don't think so. I mean, I'm a veteran, I pay for veteran insurance, but a dental crown after with insurance is like $800. Here's after insurance, my out of pocket. Here's $210.
Mexico is one of the top 10 countries for medical tourism.
The volume of the gum pushes up.
Okay.
But after they cement it, they won't move.
Dental care is extremely important because going without it can lead to things like heart disease. Dr. Paola says this work is fundamental health care.
Teeth are part important of our body. It's not just for smiling and look pretty. It's for eating. It's for speaking. It's for even for hearing. They're involved in the digestion. Some patients, because they cannot chew properly the food, have stomach issues. It's a big system. The teeth are really important.
I think when I lost my front teeth about 2.5, 3 years ago, and you're down to just sharp edges right there in the front, it's a big loss. It's a big loss, and try to live my life with my mouth closed and not smile.
How do you live your life with your mouth closed?
You find moments when you're more alone to open. Just keep it slightly closed. When you're visiting with people, you don't talk to people as much.
The thing that I recommend you always is like singing. Singing helps a lot because your tongue finds the way for the new spaces.
Amazing grace, how sweet. The sound. I'm sorry.
No apologies necessary. Aw, you're so nice.
Dr. Paola's patient is singing this song on her 35th birthday, and 1 year after she co-founded her practice, SmileMakers Group, with another dentist.
Most of our patients came here with terminal dentition. That term means that the patient has like the last era of the teeth. The most patients that we see right here come when we can not have anything for saving the teeth. So the treatment is to remove the teeth that are remaining there and place implants, and then posterior of that, do the rehabilitation over the implants.
Dr. Paola has been a dentist for 14 years and came to Mexico when the political climate forced her to leave her native Venezuela. She drives an hour to get to work 6 days a week, and the vast majority of her patients are older people.
How much do you worry about competition?
There is 1,000 of patients that can come, so I'm not worried about the competition. I think we have great dentists here in Mexico in Los Algodones, and I don't think we need to compete.
Los Algodones' dentists may not feel the need to compete with one another, but they are competing with their northern neighbors. Some of the most expensive dental procedures you can get in the US are more than 60% less in Mexico. There are a combination of reasons the prices are cheaper in Mexico. Mexican dentists make less money than their US counterparts. The government subsidizes their education, so they graduate with less debt. And Mexican dentists aren't required to have malpractice insurance, like they are in the US. Every single US visitor I met said price was the #1 reason they came to Mexico. Dental issues are some of the most frequent conditions for which doctors treat medical tourists. Between 65 and 70% of all US outbound medical travel is for dentistry.
Being Kanaka Maoli, Native Hawaiian, it's different because we're so isolated out there in Hawaii that our resources are limited. Everything gets shipped out to us, so the cost is inflated, extremely inflated.
Stephanie Manera has spent 40 of her 52 years without adequate dental care. She says where she's lived in Hawaii, dentists didn't even have the most modern equipment.
For the most part of my adult life, I've only been able to eat on this side. So for this side, if it was to go out, like if there was some kind of issue where I lost a tooth on this side, then it's a done deal. I won't be able to eat. So that's why I'm here.
Stephanie, like almost all the US visitors I met, does have dental insurance back home. It's just not enough to cover the work she needs. An estimated 74 million people in the US don't have dental insurance, which is separate from health insurance. Even Medicaid, the US's healthcare program for low-income people, doesn't guarantee dental coverage for people older than 21. Instead, states determine the type of dental care they provide, if any. And less than half of the 50 states offer comprehensive dental care.
Like I would have to pay out of pocket, and that's something that we would never be able to afford.
How long did you all have to save?
For about a good 15 years, putting aside.
To be able to get the dental care you need.
Yes.
And over those 15 years, did you feel your oral health failing you even as you were saving?
Yes, and I felt anxious that, like maybe I would just cave in and just go, do what I can over there.
Stephanie spent a week getting implants, her gap closed, root canals, and crowns. And the reason she's able to get inexpensive dental work in this Mexican town And that Dr. Paola is able to practice here goes back to one man.
Cada diente tiene una función. Déjame explicarte cuáles son las funciones. Los dientes inferiores tienen fosetas aquí, aquí, y aquí, y aquí.
Dr. Bernardo Magaña is the godfather of the dental industry in Los Algodones. But the nearly 83-year-old doesn't care about that, and he doesn't want you to either.
¿Sabes qué es lo que tenía el pueblo? 48 burdeles. Eran 48 para un lugar de 3.500 habitantes.
Dr. Magaña, who came here in 1968, is such a force in this town that he owns a lot of the land and buildings where the clinics reside.
Estoy enamorado de mi profesión. Hacemos maravillas ya últimamente con los implantes. Es la nueva modalidad de la odontología. Los pacientes que no tienen dientes y no se puede poner implantes, les hacemos cirugías y les reimplantamos hueso.
Dr. Magaña's impact on the dental workforce in Los Algodones is palpable.
Marcela, pues como te comenté ahorita, igual...
Mi doctor de cabecera era el doctor Magaña. Pues el tiempo que yo fui niña, yo creo que con él me atendí varias veces como dolor, una resina, una amalgama. Él fue casi prácticamente el que le llevaba a todos los niños, los papás, y pues y nosotros también.
Nina Delgado Morieta is a Los Algodones native who's seen her small town evolve into an international healthcare destination.
Me parece muy bien porque le da otra imagen al pueblo, o sea, ya se ve más como una ciudad pequeña, no se ve ya como un pueblo. Y pues cada año va creciendo la remodelación que le hacen al pueblo. Los pacientes que vienen aquí no son pacientes pues millonarios o ricos que se pueden atender en Estados Unidos, que lo dental es un tratamiento muy caro allá. Y ellos vienen aquí pues quizás a lo mejor a gastarse sus últimos ahorros, pero pues tratar de tener una muy bonita sonrisa y tener algo funcional con qué comer.
Los Algodones may be the self-described dental capital of the world, but it cannot be the solution for the millions in the U.S. who are only one procedure away from financial disaster.
Yo sé bien que estoy afuera, pero el día en que yo me muera, sé que tendrás que llorar, llorar y llorar.
Dental care here isn't only out of reach for working class and impoverished people in the U.S. Ironically, this flood of dollars means dentistry is too costly for the around 5,000 residents who live in Los Algodones, which is why locals receive different rates.
Sí. ¿Y es precios accesibles o es el mismo precio de los gabachos? ¿El que les dan a ustedes?
No, para nosotros es menos. Gabachos es más, ¿por qué? Porque nos traen dólares.
When we see patients from here in the town, normally we don't charge, or we just charge part of the material or the lab. So we try to help them because we know that even though we have affordable prices, the economy from United States and Mexico are different.
In Los Algodones, most tourists visit between November and April. Locals call them snowbirds. I'm here in June, the low season. Here, Mexicans, like this 70-year-old vegetable merchant, rely upon medical tourism dollars to earn a living.
Bienvenidos todos los gabachos, la gente de todo el mundo que ven este pueblo. Los doctores son buenos doctores.
How do you survive and sell your goods?
By few people that came, 1 or 2 sales a day
Oh, in the summertime.
in the summertime.
In the wintertime, how many sales?
Lots of sales.
Lots of sales. Too many to count.
Too many counts, yeah, but you were less in summer.
Not even a border wall can sever the interdependence these people have. The vast majority of Mexican residents who live here and shape the industry don't get wealthy doing so. Many are working class people, some migrating from 30 hours away to earn a living. In this town, dentistry is literally life. And it's solely because the U.S. failed to sustain life for its own people.
What could the U.S. learn from Los Algodones?
To keep learning to get better, to try to give the patient better prices so more people can come and have the opportunity to be able to get a new smile in dental health.